start off with, I'm going to invite Dr. Eyitope Fagite, who is a family practitioner, and she's speaking particularly today on mental health. Mental health, stigma or sanity. Now, we know that mental health is there's this stigma, especially amongst us Black folk. There's this stigma that we don't like to discuss mental health. Our idea of somebody with mental health is the madman, if you like, for lack of a better understanding, or somebody that outwardly demonstrates or displays or manifests lack of clarity of mind. But we know, and I'm just going to give you a quick statistic here, that according to World Health Organization, WHO, that there are on average 264 million people worldwide that suffer with a form of mental health called depression. There are loads of forms of depression, of mental health. So we have bipolar disorders, we have depression, schizophrenia, dementia, and all these are all part of mental health. But we can't cover all of that today. So I'm going to focus in on depression, because you'll be amazed how many people suffer with depression at different levels without actually recognizing the signs, whether it be emotionally, physically, or through how the habits are. And it can be a very disabilitating illness or disorder to have. So please welcome, I'd like to welcome Dr. Fagite. I like to call her Dr. T with all due respect and with her permission. Dr. T, my first question goes to you. What are the different variations of mental illness or disorder? And what is the most common one that goes undetected for us? Dr. T, you have the floor. Go ahead.
Thank you so much for the opportunity to join this beautiful set of panelists to share my ideas and to, of course, share the evidence about mental illness. I'm really happy that we all have the opportunity or to be more aware of the World Health Day, focusing more on mental health. Mental health is an integral part of our health. And unlike certain other diseases that usually have symptoms that are very obvious, mental health could often go undetected. That means people that suffer with mental illnesses may not bleed because they've got a cut, may not have a frank headache, may not be vomiting, but they still struggle. And depression in particular comes under a classification called mood disorders. And there's a wide range of subclassifications. Depression is very common. We did quote the statistics from the WHO. In fact, I remember going through medical school, we were told the prevalence of how common depression is can be up to 1 to 10, 1 in 10. So if you're in a room with 100 people, you'll be sure that at least 10 of the people in that room suffer from depression. Depression, I'll say, is quite common, and it often coexists with another medical illness called anxiety. We can actually describe it as like a seesaw. You remember when we were kids in nursery school, we used to go up on the seesaw and we'll go up and down and up and down. Normally, we want everything to be nicely flat and balanced if the mood is fine. But people that are depressed start to get that seesaw going down. And because one part of that seesaw is down, that's depression. Some other hormones or chemicals in the blood will start to go up, which is anxiety. And as physicians, what we want to do is try and get a balance between anxiety and depression. Talking more about depression, some people have absolutely no symptoms. Some people may just present by feeling tired. You just feel tired all the time for no reason. Other things people may notice include sleep problems. People may oversleep or undersleep. Some people may find you just feel down and low. Everything is going well for you. You've got a job, you've got kids, you've got your family, you've got your ministry, but you just don't have that sense of fulfillment. Sometimes that could be also a symptom of depression. And I just want to chip in here. We're going through times that are really difficult for us, the pandemic. And so far, a few studies have actually been conducted in the last year or so, some in the States, some in China. And it's shown that even with the pandemic, the prevalence or the incidence or development of mental illnesses is on the rise. especially with depression. We've all been told to stay at home. We can't see our family members. We can't go out and socialize. All of this is even having more impact. So if anybody was actually dealing with depression, I'm sure with the pandemic, you may find that you're actually tipping and starting to experience some of these symptoms the more. And I would strongly recommend that you have a discussion with your doctor. There's nothing to be ashamed about. Depression is common. Prevalence is about 1 in 10. You are not alone, and there's help available. Thank you.
Great. Great, Dr. T. Thank you so much for sharing that and for laying the foundations of what mental health is or isn't for us. Now, something that I want to pick up on during this pandemic, again, my statistics are from WHO. Of course, this is World Health Day campaign, so it's only right that we look at what they're saying and use that as the basis of our presentation. According to the WHO, during the first national lockdown, and this statistic is referencing in the UK, by the way, so it may vary for wherever you are in the part of the world. The cases of mental health illnesses with special reference to insomnia and depression actually rose from 16% to 25% during the first national lockdown. Now, of course, you don't need to be a mathematician or a statistician to figure out the relationship between the lockdown and the increase in the mental health. Not only that, but it also showed that women suffered most from this. Now, of course, we know how the burdens that our wives or mothers or sisters may bear. But what is it that makes women, and I've got something contrary to this after you answer this, what is it that makes women more susceptible to this mental health factor over anybody else? Over to you, Dr. T.
Right. I believe there are a number of reasons or possible reasons why women may find that they suffer a lot more. I believe women tend to wear many hats. Women tend to have their careers, they tend to have their families, they tend to be, they always want to reach out, they always want to help. It's just trying to juggle all of these together. And I believe sometimes women feel they're superheroes, and oftentimes they actually neglect their mental health. One of these may be adequate sleep. So what we find is that women can get so busy, they're not sleeping so well, and you find sometimes that this could be the beginning of mental illnesses, including depression. Another thing could be the hormone milieu or the hormone interactions that women have. We tend to be very hormonal because of the ups and downs with our estrogen, progestogens, and stuff like that. That could actually make us more moody and therefore make us more predisposed to suffering from some mental illnesses. Of course, there are also genetic factors. So if you come from a family where a sister or mother has suffered from depression, then as a woman, you're more likely to suffer from it due to genetic reasons. So I believe there are a lot of multifactorial or many factors that will predispose women. One is just all the hats. We wear different hats at different times. We have the hormones, and then of course we have the genetic predisposition.
Great, great. Now this is the bit where I said I have a contrary statistic here. So we have just said that women are more disposed to this high levels of depression than men. But then a statistic, I don't have that to hand, but I remember reading or seeing somewhere that the number one or number two most significant killer of men between, I think, 35 or 50 or thereabouts was depression, suicide due to depression. Now, what is it? What I'm trying to ask you really? Can we categorize people that are more prone to depression than others, or is it something that we're all open to experiencing if the conditions are right, so to say?
Right. Thank you so much for that excellent question. And yes, I'm very familiar with the evidence just quoted there. Depression affects everybody. I have treated children as young as 8, 10 suffer with depression. So it spans across ages, it spans across gender, and everybody can be affected. So men can also suffer from depression. Now, let me just delve in a little bit about the suicide rates. What happens is that, unfortunately, Depression can lead to suicidal thoughts, and some people, unfortunately, may take their own life as a result of depression. Let me tell you where the difference comes in. Women actually are more likely to attempt suicide, but men are more likely to complete suicide when they do attempt it. Men tend to use more violent means, for example, jumping in front of a train, shooting themselves. Women tend to maybe take an overdose, cut themselves. They do things. For women, it's more like a cry for help when they attempt suicide. But unfortunately, for men, we find that they are the ones that actually complete the act of taking their own life. That's what the statistics tells us. And it's unfortunate, but I personally have an experience of a sister, an older sister of blessed memory, who actually committed suicide and was successful. So it does happen both in men and women, but men tend to complete and women tend to attempt suicide more.
Okay, thank you for sharing that, and also that particular experience that was closer to home for you than for most of us have ever experienced. Thank you very much, Dr. T. There's something that I want to quickly ask here. Now, what is the difference between a low mood, feeling a bit down, and when does it cross over into what is diagnosed as clinical depression? So my direct question is, I mean, this thing is such a progressive disease, if I may use that word, or a progressive disorder, that it actually creeps up on you. And the sufferer tends to be the last one to actually recognize that they're actually going through this. What are the telltale signs when depression starts to set in? For instance, I know that one is neglect. You stop to care about your own hygiene or how you look. But when does this low mood or I'm having a bad day today, when does it cross over into where we need to take action and get ourselves properly treated? And what opportunities are there, or what solutions are out there, or how do we access treatment? So that's quite a loaded one for you. Go ahead.
Okay, thank you so much for the question. So as physicians, we look at a number of things, and I'll just throw an example out there. If a loved one dies, you're going to feel sad. You may have problems sleeping. You may feel guilty for some things, but that doesn't mean you're depressed. And that's just because there has been a clear reason why you feel the way you feel. When we go into the diagnosis of depression, we look at the duration. And usually the cutoff is 6 weeks. So if you felt terrible and it's been consistent for 6 weeks or more, then you definitely need to be screened for depression. If you're sad for a week or two because something happened in your life, we don't call that depression. If you feel a little down because something didn't go well, you were fired from your job, we don't call that depression. Although if your response or reaction to that trigger or to that problem persists for more than 6 weeks, it could be called depression. So we use the duration of time. We also look at the severity of the symptoms, and we do have rating scales out there. A very common one is one called Patient Health Questionnaire 9, or PHQ-9, which is available online on the internet, and which I would say, if you want to download, you can download, complete that. And if you find that you score high, you score, ideally we want you to score 0. But if you're scoring between 3 and 27, which is the highest, you probably need to be talking to your doctor. And thirdly, you asked about management. So the management of depression is varied. It doesn't always entail medication. Oftentimes just counseling, psychotherapy, addressing the triggers, learning healthier ways to deal with loss, for example, grief counseling, things like that could help. Definitely, there's also a place for a group of medication called antidepressants, and there are also a few other medications we call atypical antipsychotics, which we use to treat very severe depression. So yes, like I said, we look at your symptoms, we look at the duration, we look at the severity or the impact on the person's life. You talked about neglect. So if a patient or a client finds that they're in bed, they don't want to get out of bed for days, 2-3 days, they don't feel like doing anything, they're having very negative thoughts, that definitely is a red flag, and I would strongly recommend they talk to their physician.